What's the difference between a PICC line and a midline? Number one, the length of the catheter. Externally, they kind of look the same if you are not paying attention. When it is attached or inserted in your patient's brachia and you're not paying attention, you might think that your midline is a PICC line, because a midline looks like this, your PICC line looks like this. They kind of like the same, but your PICC line stands for peripherally inserted central catheter. So it's a central line only that it is inserted peripherally. The tip of the catheter goes all the way to your superior vena cava. Now your midline, although it looks like PICC line externally, the tip of the midline sits just below your axilla. Next, the indwell time. Midlines can stay up to 4 weeks, whereas the PICC line can stay over 4 weeks. How long? How many months? I don't know. Please comment down below if you are a PICC nurse. Next, who inserts the PICC line and a midline? In our facility, only the PICC nurses can do that. And how can you become a PICC nurse? You have to be certified. What about the care and your nursing responsibilities with PICC and midline? It's the same. We change the dressing regularly based on the policy and protocol. In our hospital, we change PICC line, central line, and midline dressing once a week, and we change it on a Saturday only. And why is that? Changing it once a week on the same day increases compliance. Let's say the PICC line or your central line was inserted on a Friday night. You still have to change the dressing on a Saturday. You have to be compliant because that's what our protocol says. It might be different in your hospital. That's why it's always important, and I always tell you this, to check the policy and protocol of your hospital or your unit. Now, can you draw blood from a midline? I already answered this question, but the answer is yes, it depends on your hospital. Now, because I work at the burn unit, and usually it's so hard to find an access with burn patients. So let's say they are burned on their left arm, on both legs, and you only have one arm available. That's why it's okay for our floor to use a peripheral line and a midline to draw blood. But in some facilities, it might not be the same. That's why, again, check the policy and protocol of your unit. Next, can you use alteplase on your midline? The answer is no. Well, at least in our unit, we don't use alteplase in our midline. But the PICC line, of course, every time it gets clogged or clotted or you don't get a blood return, you can always get an order for an alteplase. If you have more questions, please comment down below. And if I missed something else, Angels and Scrubs, please help Nurse Rebecca. Hello, this is Nurse Rebecca for Pinoy Nurse Portal. Please like and follow for more.